So let's just reflect quickly on Ontario. I think they've been doing a lot of testing, really accelerated, and their percent positive is still relatively low. So it's 1 point something, I don't know what it is today, which means they're testing a lot of people to find those positives. So refocusing to the targeted areas like the Torontos and the Ottawas and Peel, I think, those areas is really important. You can't distribute your testing too broadly, but really home in on supporting those areas where you're seeing those accelerations. So some of it is simply access. Having those extra access points like pharmacies might help, particularly in those cities or those areas. Two is that absolutely is worrisome, because if you have a significant backlog and people don't get the test results for a number of days, you've now lost time for doing the contact tracing. And so we can shore up the contact tracers, but if you don't know that someone's got a positive test, you're not going to be beginning the contact tracing, and that can help accelerate the spread. So it is something that we really must all work together to try and reduce as quickly as possible. I think for sure you have to leave it to the science and do it properly. Now, it's just like with vaccines, with treatments, with diagnostics too. The whole world is working at this. So we are getting a lot of different, I mean, Health Canada has already approved 37 different types of testing sort of tests. And so more will come along. I think the next generation of testing will come along, and we will sort of look forward to it. So I think at every point, people are trying to see if the timelines can be addressed. But with good reason, with good science, you can't sort of skim safety and effectiveness. So I think that's the key. Just like in vaccines, I haven't seen the diagnostic sector work this fast before either. But there is a global demand, so it is a complex environment as well. But I think we will try as hard as we can, pulling all stops, like with the other countermeasures.